Good morning to one and all. I am Ramani, Professor, Department of Fundamentals of Nursing, working in Sri Balaji College of Nursing. Course name Nursing Foundation. Course code 603. Topic Comfort Devices. Comfort Devices. Introduction. Comfort is a sense of mental and physical well-being. Physical comfort gets affected due to your dirty and wet bed and lack of body alignment, high temperatures and humidity, poor ventilation, too much of noise, unpleasant odors, and blaring lightning make the patients uncomfortable. To promote comfort for the patients, certain mechanical devices can be used. Pillows can be used for giving support for the various parts of the body. Comfort devices are mechanical devices which are used to provide comfort to the patients. That is, the comfort is a sense of mental and physical well-being. So that is now with the use of some of the devices, mechanical devices, you can give the comfort to the patients. That is called as an comfort devices. This comfort leads to how it is affected, and for some of the temperatures and humidity and poor ventilation, noise, or lightning like that, and some of the disease also, it's affected the comfort. So the patient feel discomfort. How to prevent? One of the use of the mechanical devices, that is comfort devices. Next, we see about the definition of comfort devices. Comfort is a state of freedom, a state of freedom from pain, discomfort, tension, and anxiety. That is called as comfort. Comfort is a state of freedom from what are the things? One for pain, discomfort, tension, and anxiety. These are all the things free from these are all the things. What will happen? Everyone, patient or the individual, feel more comfortable. And another one definition, if the exact definition, it is defined as contented enjoyment in physical or mental well-being, freedom from pain or trouble, that is called comfort. So this is called as a definition of comfort. Once again, I repeat, comfort is a state of freedom from pain, discomfort, tension, and anxiety. The comfort is defined as contented enjoyment in physical or mental well-being, freedom from pain or trouble. This is called as a definition of comfort. Then go for the causes of discomfort. What are the things this discomfort take place? So many things are there. One for we feel some people are irritating, or what will happen? Pain is take place, or sometimes have some of the tumor or any other do so much of work. So then anxiety, fear, and heat is increased, and lack of sleep like that. Workload is over, almost too much of workload. Difficult to handle the situation and position. So much of things in our life is take place. That is leads to discomfort for everyone to feel. So this is not causes. So this is not general causes. Everyone individual feel generally for discomfort. How to what all the other exact book discomforts, how they are explained in the book. One thing for pain due to heavy work and restriction of movement. If you are restricted the activity due to the over body weight, or any other fracture or the lower limbs like that. So what will happen? discomforters take place. The patient feel very discomfort. Sometimes it leads to the bed sore like that. That is another restrictions of movement. Another one is wrinkled bed sheet. So this wrinkled bed sheet, what will happen? Irritating the patients. Immediately the patient's sleep is disturbed and discomforted take place. So sometimes what will happen? It is continuous. What will happen? It may be it leads to the bed sore is take place. Next thing, we go for the inadequate attention to meet the personal needs. Inadequate attention to meet the personal needs. Nothing to have. What will happen? So irritating, feel very discomfort. So that is an inadequate attention to meet the personal needs. That is a fourth one causes of discomfort. Another one is lack of exercise. If it is the patient have a lack of exercise, what will happen? The patient feel discomfort. Then another one is temperature level is extreme. What will happen? The body fully very hot. Dehydration is take place. The patient feel very discomfort. So this is another one causes of discomfort. Then too bright lights. If you sit in one room, too much of bright lights, what will happen? Difficult to see the light. So glare is so much take place. The patient tolerant capacity is low, so discomfort is take place. So that is now another one reason for causes of discomfort. Then fear and anxiety. The fear and anxiety that is also some leads to the discomfort, and this is now this fear and anxiety what will happen? Lack of sleep and decrease the intake of foods, stomach pain, so much of things is happen. And another one causes of discomfort. One thing, lack of sleep. If it is the lack of sleep, what will happen? The morning, night, fully night, the fully lack of sleep. The morning, what will happen? Difficult to go for office or to do the works. So the patient feel, now the individual to feel more discomfort. So what will happen? The health status is daily it will be happen. What will happen? So the body health condition is lacking. Let's take place. Next thing is uncomfortable position. If you are sitting in uncomfortably in a uncomfortable body alignment, uncomfortable positioning, if you are sitting, what will happen? Discomforters take place. So this is a first and last causes of discomfort. So far we discuss the pain, restrictions of movement, wrinkled bed sheet, inadequate attention to meet the personal needs, lack of exercise, temperature extreme, too bright lights, fear and anxiety, lack of sleep, uncomfortable position. These are all the things is causes of discomfort. Next, we go for the devices promoting physical comfort. What are the devices to promoting the physical comfort? Right? Some of the causes we discussed. Some of the devices is promoting physical comforts. One for pillow, another one backrest, knee rest, foot rest, bed cradle, bed blocks, air cushion, rubber and cotton rings, air and water mattress, cardiac table, sandbag. What all things is devices promoting physical comfort? One for pillow. Another one is na backrest. Then knee rest. Then foot rest. Then bed cradle. Then bed blocks. Then air cushion. Then rubber and cotton rings. Then air and water mattress. Then cardiac table, and sandbag. See, the pillow is filled with the cottons like that. So that is promote very soft, and this is promoting comfort to the patient. Backrest, it is made up of, sometime they in the olden days they used for the pillows. Nowadays that is used for metal and wooden blocks. They used to make the boards look like that is na like as an wooden board. That is na look like as an wrist, back wrist. That's used for metal and wooden. That is placed over the back. So the patient lying over that wooden or metal board to prevent the respiratory distress like that. Another one is knee rest. Knee rest, that is the one thing for cotton pillow. That is it is rolled like a pillow. This pillow is filled with the cotton, and in olden days they used for wooden blocks like a rolled type that is placed under the knees to rest and to relieve the pain like that. And another one is the foot rest. This foot rest, this is the wooden blocks. Keep it in the foot to prevent the foot drops like that. And bed cradle, that bed cradle is this is mostly used for the under 5 children and older old age peoples in the bed. This is attached in the bed. So this is used, and chronically those who are chronically ill patient, that patient used for the steps of bed, and that is not bed with the bed cradles. This is not attached. This is made up of this metal like that, and bed blocks. Bed blocks is made up of this iron or wooden. This four in this bed. This is in the spot. The four legs are there. In each leg, each leg, one blocks. If it is a post-operative patients, they are used for this bed blocks to rise the food and like that. So to prevent the vomiting like that. Okay. Then air cushion. This air cushion to that the cushions filled with the air. So the patient sit over the air cushion to prevent the bed sore like that. So the rubber material, that rubber material look like as a cover or the look like a pillow model or the bed model to fill the air to use it over the table, the bed. Rubber and cotton rings. This rubber and cotton rings, this is made up of rubber or cotton. In that cotton is gauze pieces rolled over the rubber material, the cotton rings. This is covered with use of the cottons to cover. And another one model is a cotton, then another one ring to filled with the air. That is in a rubber rings. That is in a rubber and cotton rings to prevent the elbow pain and elbow sores like that. Another one, air and water matters. Air and water matters is a look like a air and cushion. It is made up of the rubber material. Look like as a mattress, and this side is look like as a mattress, and enter there's to filled with the fill that water or air into the mattress. So to prevent the pain, and mostly this some of the arthritis problems used for the water matters, air matters like that. So much of people they used for this one, and to prevent the bed sore, that is an air and water matters. Another one is a cardiac table. This cardiac table is made up of wooden or iron or the metal that is placed under the in the foot end of the bed. This is mostly used for the cardiac patient. This is attached with the bed. Sometimes separate wooden cardiac tables also available. This is one stand is there, or one stick, one stand is there. In the stand, over the stand, one table is attached. That is when the patient is asking, the table is keep it in front of the patient, so easy to lean over the table or take the rest of the table like that. And some hospitals nowadays they used for the cardiac table, cardiac iron with cotton cardiac table. A iron with wooden cardiac table is attached with the pillow, so that is attached with the foot end of the bed. Easy to lift the table in front of the patient. So another one is a sandbag. The sandbag is filled with the sand. So this is very useful to the patients to prevent the foot drop like that. Then another one is used for traction, used for during the arthritis problems. If you are putting for any other traction like that, hang over the in the stand, and the sandbag is tied with one rope. Then at the end of the rope, you can tie it with this patient's legs. So this way to use the or to administer the traction to the patients for any other cramps like that. So this is a device promoting and physical comfort to the patients. What are all the things? What are the devices? One for pillow, backrest, knee rest, footrest, bed cradle, bed blocks, hair cushion, rubber and cotton rings, air and water mattress, cardiac table, sandbag. Now we go for the comfort devices. What are all the comfort devices? One by one we discuss. In above slides, we discuss what is the comfort devices. What are all the comfort devices? That is made up of what? We discuss. Yes. Now we discuss about the one by one. One for the pillow. It is a comfort device. It is used to give comfortable position to the patient. These are mostly used to support various body parts, that is called pillow. It is a one of the comfort device. It is made up of the rubber or plastic or cotton material. This in that in a square shape or round shape like that, in this square shape, to fill the cottons into the cloths, to fill it, and it is used to comfort position to the patient. It is support the not only for the head and various parts of the body. This is called as a pillow. The pillow, like as this is comfortable position to the patients. This is called as a pillow, right? Next, we go for the next slide. What is the purpose of pillow? Okay, to maintain proper body alignment, to support body parts in good alignment, to reduce the pressure. That is called as a purpose of pillow. One for maintaining the body alignment, then give a good alignment to the body and reduce the pressure. Next, go for the backrest. Already we discussed it is a mechanical device, or it is a made up of wooden or iron material. In the more and more olden days, they used for the pillows look like as a backrest. What is the backrest? It is a mechanical device. It is a mechanical device which provide support for the patient in the sitting position. This is called as a backrest. Purpose of the backrest. So to support the back, to facilitate easy breathing, it is given especially for heart and asthma patient, even in patient operative period, to support the back, to facilitate the breathing. One for the support the back and easy breathing, and to used for the especially for the heart and asthma patient in the post-operative period. This is purpose of backrest. Third one, it is called as a knee rest. This is called as a knee rest. In olden days, used to like this only for the back rest. This is for the knee rest. It is made up of the cotton, or sometimes this is made up of the wooden. This is made up of. To rest the knee and to relieve the pain over the knees. One for this is gives relaxation and thus relieve the pain and abdomen. One for relieves pain on abdomen muscles and tendon beneath the knees. Okay, this gives the relaxation of the patients. This is one of the practice for using in olden days. It is for give the relaxation also, and is to relieve the pain on the abdomen and on the abdominal muscle on tendons beneath the knees. That is called as a knee rest. Once again, I repeat, this gives relaxation and thus relieves pain on abdomen muscle and on tendons beneath the knees. That is called as knee rest. Purpose of knee rest. One, for maintain proper body alignment to support body parts in good alignment to reduce the pressure. One, for proper body alignment, good alignment, and to reduce the pressure over the under the knees. So with the use of a knee pillow to reduce the pressure also. Then next we go for the next thing. This is the purpose of knee rest. One, for maintaining the proper body alignment to support the body parts in good alignment, reduce the pressure. Fourth one, foot rest. This is a device, so place that the feet rest firmly against upper. This is called foot rest. This is called as a foot rest. This foot rest is made up of wooden or metal. This is made up of made it. This is in golden. For example, definitely the exact example is when this foot rest is used for tailors. They used for one wooden blocks, because the legs are rest over the foots are rest over the wooden blocks. So to prevent the foot drop like that. So that one you can use to the patient. This is now made up of wooden or metal. This is a device placed that the feet rest firmly against up. That is called bed rest. Another one is purpose of bed foot rest. To maintain the normal position of feet, to promote comfort, to prevent the foot drop. This is called as the purpose of foot rest. Once again, I repeat, to maintain the normal position of feet, to promote comfort, to prevent foot drop. This is the purpose of foot rest. Fifth one, bed cradles. Bed cradle. The bed cradles support and take off the weight of the bed clothing. This is called bed cradle. Once again, repeat, to hold the bed cloths to the patients. That is the bed cradle. The bed cradle supported and take off the weight of the bed cloths. That is called as a bed cradle. Purpose of bed cradle: to prevent the top cloth if coming in contact with the patients, especially burns patients, because this is to lift the bed blankets. So to prevent the contact with the cloths, contact with the burns patients, the skin or contact with the skin. That is one thing. Another one, to prevent fall on the bed. Another one, that is the second one. That is an exact definition: to prevent the top cloth if coming in contact with the patients, especially burns patients, to prevent fall on the bed. This is the purpose of bed cradle. Sixth one, bed blocks. Made up of wood or metal are used to raise the foot end or head end of the bed. That is called bed blocks. Made up of that is in a this is called as in a bed blocks. In olden days, this is used for the bed blocks in a wooden. In nowadays, that is in a metal. They are used. They in mechanically. Sometimes they used for rise or down. Likewise, a front and back also raising and not raise. Sometimes not raising for food and sometimes raise for the food and sometimes for the hidden. This is if you are using for wooden blocks, need for another one person is a must. Need for the another one help. No need. Nowadays is attaching with the bed legs, 4 legs. So no need to need for the another one help. Only for mechanically you can press the button to lift the head and or lift the foot and like that. Like that, this is used. Okay. This is now wooden block 6 to 8 inches and bed frame. That is the mattress and box spring mattress. The head is immediately 6 to 8 inches. You can raise it to use the bed blocks. And this is mostly used for the post-operative patients. Sometimes those who are suffering from cardiac problems or any other surgery patients like that. That type of patient only they used the bed blocks. What is the exact definition of this bed blocks? It is made up of wood or metal or used to raise the foot end or head end of the bed. That is called as in a bed blocks. Purpose of the bed blocks: to maintain the proper body alignment, to support body parts in good alignment, to reduce the pressure. That is called as in a bed blocks. One for maintaining the proper alignment, to maintain the good alignment, to reduce the pressure. That is called as in a bed blocks. The next one we go for the sandbags. Sandbags are used to immobilize a part as in fractures and relieve the discomfort. These bags are made up of the rubber or rubber material as well as the cotton material. These bags are filled with the sand, then that is tied properly, stitched properly. Then these things of bags are mostly used for fracture or spines or some of the fractions like that. That patients are used for this one to hang it over the one ramp and then to apply the traction. This is mostly used for when applying for traction. That time used for the sandbags to immobilize the particular part or legs like that, or the hip like that. So this is used. Exact definition: sandbags are used to immobilize a part as in fractures and to relieve the discomfort. This is a sandbag. See, this is the sandbag to fill the sand and to tie it properly. This is made up of the rubber. In older days, used for the cloths like that. Then they apply for the traction. They used to for the sandbags. Next, to move for the purpose of sandbags. One for to relieve discomfort, to support body parts in good alignment, to reduce the pressure, to prevent the foot drop. This is sandbag purpose. One for relieve the discomfort. Another one, good alignment to give. Then pressure level is reduced. So to prevent the bed sore. Another one, prevent the foot drop. So this is all the purpose of sandbags. Next, we move for the air cushion. Air cushions are made up of rubber and it can be inflated with air, used to take off the weight of the body and to relieve pressure on certain parts of the body. That is called air cushion. Air cushion, see, the air cushion is sometimes made up of nowadays is made up of rubber material to inflate the air. So take the weight of the body and relieve the pressures. In olden days, also used for some of the sponge they used to use, and the sponges are inserted into the cloths, and then they used to the patient to prevent the pressure sore like that. Nowadays is a air to inflated. Then they used the exact air cushion. The olden days they used. This is the air cushions. Once again, repeat. Air cushions are made up of rubber and it can be inflated with air used to take off the weight of the body and to relieve pressure on certain parts of the body. That is called air cushion. Purpose of air cushion: to relieve discomfort, to reduce the pressure. That is called as air cushion. Rubber and cotton rings. These are used to relieve pressure on certain parts of the body like elbow and heels. That is called as a rubber or cotton rings. See, this cotton rings or this cotton rings, it is made up of rubber, but the no halo is there, but fully rubber is there in a round ring. This is mostly used for schools playing one article, playing article, and this is used for in this rubber material, the rubber ring uh, used for the patient to roll it over the rings with the use of gauze pieces, then to prevent the irritations like the discomfort to avoid it. And another one is rubber material. This is made up of another one type. This ring, the rubber material is this tube is filled with the air. So applying the patient. Another one material is filled with the water. So this types also applying the under the elbows. So this is now nowadays they used for the two things, one for air and water. And another one is now one for in the olden days they used for the rubber material. This is one of the need of play articles only. And the exact application, these are used to relieve the pressure on certain parts of the body like elbow and the heels. This is called rubber and cotton rings. What is the purpose of rubber and cotton rings? Lift the hip from bed to prevent bed sores, to prevent direct pressure on bony prominence, to improve the circulation. That is the purpose of rubber and cotton rings. One part, prevent the bed sore, and to prevent the pressure on the bony prominence and improve the circulation over the elbows. That is called as a purpose of rubber and cotton rings. Another one, next thing is air and water matters. This air and water matters. It is made up of rubber material. This is look like as a mattress. It is filled with the air and sometimes the water. Two types is they are prepared and sale particularly in the hospitals to prevent the pressure sore. This so mostly and for those who are unconscious or paralyzed and auto patients, that patients also mostly used for this one. And exaltation, these are used for very thin and very obese patients and those who are prone to pressure sore. That is called as an air and water matters. What is the purpose and the air and water matters? One, to relieve the discomfort, to improve the circulation, to prevent pressure sore. That is called as a purpose, and air and water matters. That is a purpose. One for provide your comfort, relieve the discomfort, improve the circulation, prevent the pressure sore. This is called as an air and water matters purpose. Next thing is cardiac table. It is a mechanical device which provides support for the patients in the sitting position. Already we discussed in the comfort devices. This is now made up of iron as well as the wooden. So this is separately, this is handled sometimes. Sometimes it is attached with the foot end of the bed also. So easy to lift in nowadays. It is a mechanical device. It provides support to the patients. This is used for eating, during the eating or sleeping or watching TV or rest the hands like that. So this is used for the cardiac table. Exact definition: it is a mechanical device which provides support for the patient in the sitting position. Purpose of cardiac table: to support back, to facilitate easy breathing, to read it, to take rest. One thing, to support the back, to give the breathing comfortably, and to reading, give the reading, eating, and give the rest. So the purpose to use the cardiac table for cardiac patient. Mostly used cardiac patient, respiratory problems like that. So this is the purpose of cardiac table. Then role of nurse in comfort measures. One for what all the role for nurses in comfort measures. Nurse identify comfort needs of the patients and the family members. One thing. Another one, nurse the design interventions to identify the needs. First, to identify the comfort of the patient. Another one, to draw the intervention. In that intervention, the comfort devices is must or not. That is, the nurse should identify, and intervening variables are considered when designing the intervention. Which type is, which design, which one is suitable for this intervention? Like that, that is maybe the wooden or iron or the air mattress, water mattress, like that. Which one is suitable? You can select it. When interventions are delivered in a caring manner and are effective, and when enhanced comfort is attained, interventions are called comfort measures. Then the interventions are delivered in a caring manner and are effective, because you are already identified and select, and you can give, so easily you can achieve the intervention goal. So that is in a comfort measures. The patient and nurse agree on desirable and realistic health seeking behaviors. That is, should also the nurse should be assessed. What is the role of nurse in comfort measures? One, for nurse identify the comfort needs of patients and family members. Another one, nurses design intervention to identify the needs. Another one, intervening variables are considered when designing interventions. When interventions are delivered in a caring manner and are effective, and when enhanced comfort is attained, interventions are called comfort measures. Patients and nurse agree on desirable and realistic health seeking behaviors. Next we see the continuation of the responsibilities. If enhanced comfort is achieved, patients and family members are more likely to engage in health-seeking behaviors. These features further enhance the comfort. When patients and family members are given comfort, care, and engage in health-seeking behavior, they are more satisfied with the health care and have better health-related outcomes. This is another one responsibility. When patients, families, and nurse are satisfied with health care in an institution, public acknowledgement about that institution's contributions to healthcare will help the institution remain variable and flourish. This is another one responsibility. Once again, repeat: if enhanced comfort is achieved, patients and family members are more likely to engage in health-seeking behavior. This further enhances comfort. When the patients and the family members are given comfort, care, and engage in health-seeking behaviors, they are more satisfied with health care and have better health-related outcomes. Then patients, family, and nurses are satisfied with health care in an institution. Public acknowledgement about that institution's contributions to health care will help the institution remain viable and flourishable.